So my name is Dr. Junaid Bunchi. I'm a family medicine trained physician. Some of the challenges we've seen over the recent years that we're facing is number one is a higher acuity mix of patients. Number two, ways that we can reduce our return to acute care. And three, as we all know, there's shortages across the medical field. We're looking to implement technology that can help decrease the burden of these difficult challenges that we're all facing and help us provide great care for our patients. We have seen an increase in higher acuity mix of patients. Our volume has gone up, and sometimes we don't have as many resources as we would like to have. It's very beneficial to have a monitoring system that can keep eyes and ears on the patient continuous 24/7. It really helps us focus on the patient, have information at our fingertips any time of the day, and really helps us be proactive in identifying things that may be changing in their condition and helps us provide them the best care that we can. One of the great challenges that we face at our facilities is trying to reduce the number of return to acute care. Many of these patients have chronic medical conditions that worsen while admitted in the hospital, which cause them to go back to our acute care facilities. Now, having this continuous monitoring system is excellent because number one, it helps us provide a baseline on admission. It also lets us continuously monitor them to see if their vital signs are changing and if their medical condition is worsening. A lot of times, when we're doing a vital signs Q shift or whatever, a few hours may go by before we get new information. But with this system, we can set up alerts individualized to each patient, sending us alerts if there's any acute change in condition, therefore being able to administer the best medical care that we can at that time. One of the great things we've seen with continuous vital sign monitoring is the satisfaction that we see from our patients and their families. A lot of times these patients come to us suffering COVID-19, a respiratory failure, congestive heart failure, or something severe that required a stay in the ICU. Now, when we're coming to these other facilities, they may feel that the amount of attention or the amount of resources are not there. That does provoke some type of anxiety. But having this continuous monitoring system, the patients and family knows that somebody is watching 24 hours a day. It really gives them peace of mind and reassurance that there's someone always watching their loved one. Is that it doesn't require any additional work from the physicians, the nursing staff, the respiratory therapists. Everything is monitored remotely 24/7, taking the burden off of the physicians, the nursing staff, and all the individuals working hard in the hospital. We're able to focus on the patient, and all of the data that's being collected is given to us the way we want it. We can individualize each plan for each patient and being notified for specific numbers for individual patients. This takes a huge burden off us trying to go through all of this data and trying to find what is significant, what is not. All of this is done remotely and is based off of what we as the physicians want it to be. Another area that this continuous monitoring system has significantly helped is increasing the trust and collaboration between acute care facilities. When patients are sent to us from an acute care facility, they know we have the monitoring system to keep eyes on this patient 24/7 and provide, if not the same amount of monitoring the individual may have been receiving in the ICU. Now, this is something very unique, and it gives confidence in these referring hospital systems that they know that we're able to provide the same acuity of care as they have been over the past few weeks.